Welcome to Abudoni Health Channel. The quality health tips you can trust.
Anthrax is a serious bacterial infection that can affect both animals and humans. It is caused by the bacterium Bacillus anthracis, which can be found in soil and on plants. Anthrax can be spread through contact with infected animals or their products, or through the air. Anthrax is a zoonotic disease, which means it can spread from animals to humans. In Nigeria, anthrax is most commonly found in livestock, such as cattle, sheep, and goats. It can also be found in wildlife, such as antelope and rodents. Anthrax can be transmitted to humans through contact with infected animals or their products, or through the air. Inhalational anthrax is the most serious form of the disease, and it can be fatal if not treated promptly. GI anthrax and cutaneous anthrax are less serious, but they can still be deadly if not treated. There have been a number of anthrax outbreaks in Nigeria over the years. In 2011, there was a major outbreak in the northern state of Zamfara. The outbreak was caused by the illegal sale of contaminated animal hides. At least 50 people died from the outbreak. In 2017, there was another major outbreak of anthrax in the southern state of Ogun. The outbreak was caused by the illegal grazing of cattle in contaminated areas. More than 100 people died from the outbreak. The Nigerian government has taken steps to prevent future anthrax outbreaks. These steps include vaccinating livestock against anthrax, educating people about the risks of anthrax and how to prevent it, monitoring livestock markets for signs of anthrax. Despite these efforts, anthrax remains a serious problem in Nigeria. The government needs to continue to invest in prevention and control measures to protect the public from this deadly disease. Here are some additional things to keep in mind about anthrax in Nigeria. The rainy season is the most common time for anthrax outbreaks in Nigeria. This is because the bacteria that causes anthrax can survive in wet conditions. People who are most at risk of anthrax infection in Nigeria include people who work with livestock or their products, people who live in rural areas, people who eat contaminated meat. If you think you may have been exposed to anthrax, it is important to seek medical attention immediately. Anthrax can be treated with antibiotics, but the sooner treatment is started, the better the chances of a full recovery. Symptoms. The symptoms of anthrax vary depending on how the infection is acquired. Inhalational anthrax, which is the most serious form of the disease, can cause fever, cough, shortness of breath, and chest pain. GI anthrax, which is caused by ingesting contaminated food or water, can cause nausea, vomiting, diarrhea, and abdominal pain. Cutaneous anthrax, which is caused by contact with the bacteria through the skin, can cause a black, painless sore. Treatment. Anthrax can be treated with antibiotics. The sooner treatment is started, the better the chances of a full recovery. Inhalational anthrax is usually treated with a combination of antibiotics for 60 days. GI anthrax and cutaneous anthrax are usually treated with antibiotics for 10–14 days. Prevention. There are a number of things you can do to prevent anthrax infection. Avoid contact with animals that may be infected with anthrax. Do not handle animal products that may be contaminated with anthrax, such as hides, bones, and wool. Cook meat thoroughly before eating it. Wash your hands often with soap and water, especially after handling animals or their products. If you are exposed to anthrax, seek medical attention immediately. Conclusion. Anthrax is a serious disease, but it is preventable. By following the tips above, you can help protect yourself from anthrax infection. Thank you for watching. Click the like button and share the video. Thank you for watching. Subscribe and like for more videos.